When it comes to autism, people often want a simple cause and effect. This one thing leads to that diagnosis. It's completely understandable, but the reality is far more complicated. I'm Dr. David Danish, a double board certified psychiatrist, and today I'm going to unpack one of the most debated topics in autism research: how inflammation, glutathione, and everyday medications like Tylenol might intersect in shaping brain development. Stick around until the end because I'll also share the most promising antioxidant strategies that I've personally recommended to patients struggling with autism or OCD or anxiety. Think of inflammation as your body's fire alarm. It's supposed to protect you from threats like infection or injury. But if that alarm goes off during pregnancy, it can influence how a baby's brain wires itself. Large studies have shown that complications like maternal fever, baby prematurity, or even respiratory distress in newborns raise the risk for autism. More recent research shows how maternal obesity, even before pregnancy, can increase this risk as well, also because of inflammation. These various stressors trigger oxidative stress, when harmful molecules called free radicals start to outnumber the body's defenses. This is not unique to autism. Oxidative stress and neuroinflammation also show up in a myriad of other psychiatric and neurologic disorders, including depression, bipolar disorder, ADHD, PANS and PANDAS, post-stroke recovery, dementia. On and on you go. This kind of inflammation plays across all aspects of brain functioning. Now, today I want to talk a little bit about Tylenol, also known as acetaminophen. It's one of the most common pain relievers used during pregnancy and in early childhood. For most people, it's safe and very effective. But when your body breaks Tylenol down, a small amount of that, a metabolite of that, becomes a toxic byproduct called NAPQI, or N-acetylcysteine. Normally, your body neutralizes this toxic byproduct with something called glutathione. That's the body's master antioxidant. But here's the catch. That process uses up that glutathione. And if you're already running low, you can see how Tylenol might tip the scales further towards having more oxidative stress. For most pregnant people and young children, occasional Tylenol use is not a problem. There's enough glutathione. The concern seems to apply to a small subset of people, those who already may have low glutathione because of genetics, nutrition, or previous illness, recent illness, current illness, where Tylenol could add a bit more oxidative stress at a sensitive time. Even then, the preponderance of evidence is mixed and still evolving, so this remains an area of active research rather than a settled conclusion. So why are so many talking about glutathione and how it might relate to autism and other neurodevelopmental disorders? Research shows that children with autism often have lower glutathione levels and a higher ratio of oxidized to reduced glutathione, a sign that their antioxidant defenses are strained. Brain studies confirm this too. Regions like the cerebellum and temporal cortex show both glutathione deficits and oxidative damage in those areas. And genetics add another layer to this. Certain variations in glutathione-related genes, GSTM1, GSTP1, make some children less able to recycle glutathione. This means those children are more vulnerable to stressors, whether it's an infection, environmental toxins, or medication exposure during pregnancy or during early childhood development. Put simply, glutathione is not the whole story of autism, but it's a recurring theme in biology and something that is being studied very actively. If low glutathione is part of the problem, potentially, the next natural question might be, can we boost it? Yes, one way is with N-acetylcysteine, or NAC, a supplement that acts as a building block for glutathione. Small clinical trials have shown that NAC can reduce irritability and repetitive behaviors in some kids with autism. It's also being studied and has benefits for people who have OCD or hair pulling, also known as trichotillomania, and various forms of anxiety. It is not a cure for most, but it's a hopeful avenue, supporting the brain's natural defenses instead of just managing symptoms. So where does all this leave us? Autism does not come from one cause. Let me be very frank about that. It emerges from a web of genetics, inflammation, oxidative stress, and environmental factors. Tylenol alone does not cause autism, but in children with vulnerabilities, it may interact with glutathione pathways and increase the risk. The good news here is that by understanding this biology, we can begin to target it, not with blame or fear, but with smart, supportive research and then smart, supportive interventions. And for more information about the very questionable link of Tylenol during pregnancy and autism, please check out my other YouTube video on this subject where I go into that in a deep dive. One of the core outcomes that I want you to bring home from that is it is actually more likely the reason for taking Tylenol during pregnancy, in other words, fevers, inflammation that's already going on, that is the culprit there. But given what we talked about today, and given genetics that we don't know about yet, could it be that in a very small subset of patients, Tylenol is also playing a role there? We will find out over time. If this was helpful at all, please share it with others. Please like and please subscribe so we can get the word out there about how this important science is evolving. And hopefully over time, we can get some more definitive answers. I'll see you in the next video.